Cancer, the word cancer back in the 50s was a death sentence, not any care about what type of cancer you had. Cancer was scary. My name is Alfred Johnson, and I'm originally from Florida, but I live in Massachusetts. I'm 83 years old, and I'm a retired medical laboratory technician / cardiac ultrasound technician. In the early 2000s, I experienced some back pain. My primary decided to do a 24-hour urine and found that my Bence-Jones protein was elevated and referred me to hematology. Being referred to hematology in the beginning kind of frightened me because I knew it meant something was going wrong with the blood. Hematology clinic did a biopsy and found I had a number of cancer cells. I knew about myeloma at a young age, and I knew it was deadly. Cancer, the word cancer back in the 50s was a death sentence, period. I mean, not any care about what type of cancer you had. Cancer was scary. I asked to be transferred to the Dana-Farber because of the name, and my wife had been a patient as well at Dana-Farber. I met Dr. Munchie's group in 2009 and was followed by him from 2009 to 2017 as smoldering myeloma. Way before I met you. 2017, a repeat biopsy was done, and the cancer cells had increased, and it was time for treatment.
I'm Nikhil Munshi. I'm professor of medicine at the Harvard Medical School. Mr. Johnson has been my patient. He's diagnosed with multiple myeloma. He has been coming to Dana-Farber for a number of years and has done well. The incidence of myeloma is significantly higher in African American compared to Caucasian. It's almost twofold. Both in men and women, there is a twofold increase. But we observed that when excess is equal, the survival is actually superior in African American compared to Caucasian. We observed this in younger patients, not as much in older patients, but in older patients also, it's similar. It's not inferior in African American. So unlike what traditionally we believed, it gives us a good understanding that if you equalize the excess, the results could be quite important. Mr. Johnson proves the point that when you get a good access, you could do well.
I felt very comfortable after seeing Dr. Munchie and his group that, similar to diabetes, there's no cure, but it can be controlled. I started treatment on August 2017 with Velcade injections and Decretron, a steroid, as well as 15 milligrams of Revlimid, which is a new drug.
We are a very heterogeneous society now. That's a critical element of what we are. And addressing the needs of all the subgroup, medically speaking, is critically important. So the need that our lawmakers need to consider is that there are differences in outcomes, there are differences in incidence, and there are cancers which may be increased in one population versus another. Not everything is increased in African American. Various other cancers are higher in Caucasian population. So we need to study them, and so there is some need to push for increased research focused on this.
Well, I've said many things to my friends about getting checked on a regular basis. As opposed to ignoring some of the symptoms they have, it's better to go see a physician and find nothing wrong as opposed to ignoring it, and it's tougher to take care of. Get it checked. Doesn't hurt.